All right, thank you for the opportunity to present here at SAGES. I'm presenting today post-op bariatric patients during the pandemic, weight loss falls off the wagon. So when the COVID-19 pandemic hit, the fight against the obesity epidemic also took a hit, and surgical obesity management was affected in many ways, including less social and professional support, limited access to food and gym facilities, as well as a change in patient routines, whether it was dietary changes or changes in exercise. We collected data from bariatric program patients from April 2019 to April 2020. So this included both pre-operative bariatric patients that have been started on a medically supervised diet, as well as post-operative patients that had either received a sleeve or a Roux-en-Y. We conducted telephone interviews, and we were able to collect data from 139 patients that we did the analysis on. We surveyed weight, both objective and subjective, exercise, as well as diet. And as you can see here, the age, sex ratios, and Charlson comorbidity indices are comparable between our pre-bariatric and post-bariatric patients. And looking at our results here, so looking at subjective weight as evaluated by clothing fit, you can see that despite the fact that all of these patients were either on a medically supervised diet or had already received bariatric surgery, 51% of patients felt like their weight was unchanged, and 16% of patients even felt like they had gained weight. Looking at exercise, we can see that 61% of patients felt like they had decreased exercise, and kind of breaking that down even further, when you compare pre to post stay-at-home order, we can see that the hours per week of exercise mean decreased from 4.5 to 2.6%, with more than double the amount of patients saying that they didn't exercise at all, 20% up from 8%. Looking at dietary habits, 41% of patients also said that they had worsened dietary habits. Looking at objective weight loss data here, we can see a decrease in weight loss rates for all patients. We can see that more so for our post-bariatric than for our pre-bariatric patients. As you can see here, the red arrows indicate our excess weight loss per month. This is pre-COVID. And then all the other bars indicate post-COVID. You can see that the rates have decreased a lot. In our medically supervised diet group, we can see that our rate also decreased. However, this is not a statistically significant finding. In terms of our limitations, so our mean follow-up time for pre-COVID patients was 6 months versus 9 months for during COVID. So it's possible that the initial rapid weight loss that we typically see in the first 6 months had already gone down to its expected lower rate by the time we conducted the survey. There's also a possible difference in office and home scale calibrations, as well as recall bias. In conclusion, the pandemic had a multifactorial detrimental impact on both pre- and post-op bariatric patient weight loss efforts. And I think for the future, we can further investigate weight status at extended time points to assess possible continued effects of COVID on bariatric patients. Thank you very much.